Most chronic pain and mobility loss are treated downstream. Orthotics for the feet, braces for the knees, and injections for the backs. But it often starts with a foundational breakdown in the way we move, and no one has fixed it at the root. I'm Joe Monroe, new CEO of GraMedica. I'm privileged to have contributed to the growth of over 20 healthcare companies, driving the strategic, commercial, and operational work that has led to milestones such as IPOs, acquisitions, or sustainable scale. But the patients I'm advocating for today may be the most overlooked and underestimated breakthrough opportunities of them all. 25% of the world's population lives with chronic foot misalignment. What starts as a subtle shift in gait leads to fatigue, joint strain, pain, and long-term mobility loss. And this is across every age group and geography. GraMedica offers a structural solution that works, where insoles, braces, and therapy fail. This is early in the journey, but the need is global, the scale is absolutely massive, and the system can no longer afford to wait. Do you remember the last time you walked across the sand at the beach and looked back at your footprint? That imprint says more about your body than most people realize. There are 3 common footprint types. On the far left, flat foot. The arch is collapsed, causing the ankle to roll in and the foot to lose stability. In the center is a normal arch that absorbs shock and keeps the body well balanced. And to the far right is a high arch, way too rigid, putting stress on the heel and the ball of the foot with every step. These aren't cosmetic traits. They reflect how weight and force are distributed through the body. HyProCure is the first and only implant that corrects the structural cause of foot misalignment, right at its source. Most treatments offer temporary support. HyProCure realigns the foot permanently. Developed by a foot and ankle specialist, HyProCure targets the teletarsal joint, foundation of balance and motion. It's one 20-minute procedure, one permanent correction, and one proven path to full body realignment. This is true minimally invasive surgery, built for modern care delivery. One small incision, no screws, no bone drilling, no joint fusion. HyProCure is designed for both podiatrists and foot and ankle surgeons, making it accessible across specialties. Procedure can be performed in office, in ambulatory surgery centers, or hospitals based on the patient needs and provider preferences. Patients, both children and adults, can often walk within 24 hours after the procedure and return to full activity within just 1 to 2 weeks. It's easy to perform, quick to recover, and scalable by design. Let me walk you through what it looks like. It starts with one small incision, often just 1 centimeter, over the sinus tarsi, a natural space on the outside of the foot. The physician gently creates a pathway and clears soft tissue. No bone is cut. They test a few implant sizes to find the one that restores alignment while preserving full foot motion. Range of motion testing ensures that the foot can still pronate and supinate. Once confirmed, the HyProCure implant is inserted between the ankle and the heel. No screws, no drilling. Fluoroscopic imaging confirms that the implant is seated correctly and achieving anatomical correction. The joint is immediately stabilized, realigning and restoring alignment with the preserved mobility. It's structural correction that works with the body and can be easily reversed if ever needed. HyProCure is not experimental, it's validated. A new landmark 8-year study published in Orthopedic Surgery this year tracked thousands of feet and showed great results across all patient ages. In the pediatric group specifically, it's opening up new possibilities and indications for use around the world. The results were fantastic. 99% implant success rate. Anatomical restoration was confirmed via imaging, and measurable improvements in gait, pain relief, and arch support. And that's just one study. We have now helped over 100,000 patients around the world and counting. The results hold up across diverse geographies, age groups, and care settings. There are over 100 clinical publications, including 25 gold standard peer-reviewed outcome studies, all of which are consistently confirming HyProCure's long-term safety and durability, biomechanical correction, preservation of the natural joint motion. No other implant has demonstrated this level of correction, minimal invasiveness, and long-term clinical success in treating the teletarsal instability. Since stepping into GraMedica this past March, we've been having a lot of fun. We started by restructuring the entire commercial foundation. In just 90 business days, we moved from a tactical execution to strategic scale. Here's what we accomplished. Starting with reframing our value proposition based on evidence and direct insights from our patients, podiatrists, surgeons, and global market leaders. Following that, we launched new clinical messaging, not just around the symptoms, but around structural correction and long-term biomechanical outcomes. Following that, we validated new clinical data and publications, and this has presented and created the opportunity to pursue expanded indications for use and reimbursement support. Based on that, we decided to start in our home country of the US and submit 2 key regulatory applications. The first is a Category 1 CPT code request to the American Medical Association. The next is a Breakthrough Device Designation request to the FDA. We've also carried that momentum and submitted to all the major GPOs and federal contracting systems in the US, like Premier, Vizient, HealthTrust, ECAT, and GSA, using the same data to qualify under value-based and breakthrough pathways, bypassing the standard 3 to 5 year contracting windows. Following all of that, we've launched a global content engine, activating brand storytelling across LinkedIn, YouTube, TikTok, and Instagram. The momentum is building. Please follow along, share your stories, and help patients everywhere find access to structural relief. Next, we're focused on deepening our KOL network, continuing medical education efforts, and laying the groundwork for new R&D innovation by early 2026. This isn't just a turnaround. This is a reset with traction, and it's moving fast. Our global KOL network led the way, with a strong first wave of early adopters across multiple regions. But the momentum doesn't stop there. HyProCure is ready to scale across care settings, geographies, and clinical applications. It aligns with a broader movement forward: minimally invasive solutions, outpatient and ambulatory care models, and long-term structural correction. The foundation is built, the demand is global, and the commercial engine is waiting to be ignited. We have reached 100,000, but we still have 1.999 billion left to serve. As an advocate for those people, I'm asking for your help, your introductions, your partnerships, your belief in what's next. Whether you're a patient, strategic partner, physician, distributor, OEM, you can help scale the first structural solution in foot and ankle care. Let's restore movement. Let's give people their lives back. Let's move the world 1 foot at a time.